start with what is workflow. ER workflow at the West Vet is the process in which a patient moves from the front doors through multiple conversations with a doctor and client, diagnostics, treatment, and either gets to go home, has a procedure, stays to be hospitalized, or has to say sad goodbye. Workflow is the basis of this training, how we can use it and how we can better communicate, and especially when it's busy and everyone's going in different directions, how we can communicate more effectively. Workflow is important because it improves efficiency. There are multiple patients working through their workflow simultaneously between different doctors, DCs, and different technicians. As a whole, we need to work together and improve this efficiency to serve our clients timely. Wait times are not just a client issue. Doctors have to wait often for care plans to be signed off and money collected. Doctors have to wait for diagnostics to be completed so they can move forward with their treatments. Technicians have wait times waiting to find doctors who may have gone into rooms to discuss any complications we might be having to complete the requested diagnostics or treatments. And if there are critical values of diagnostics, we have to wait till we can talk to a doctor. Side note, if there are critical values that need to be discussed and the doctor on the case is not available, you do need to find the closest doctor to verbalize always. Because sometimes we need to interrupt the doctor who may be in a room either with this particular patient's client owner or a different one. DCs also have wait times. They are keeping the clients informed about the status of a workflow of their pet and requires the DT to know the correct people to ask for each of those pets. Using the tools that we have to improve communication between all these moving parts will improve many aspects of our communication. It will also improve patient safety as we slowly move into our busier time of the year. Unfortunately, there are many patients that might get sent home before treatments are completed, or the patient may receive 2 doses of medications or have multiple blood draws when not necessary. This is because multiple people are trying to stay ahead of treatments, which is great, but they have not properly communicated. All of these cause a type of frustration. And in the ER, frustration builds exponentially during our long 8, 10, or 12-hour shifts. It depends on our week, but sometimes this is the first day, and by the last day, we don't even want to walk through the door. For clarification, I did not personally create Smartflow. Smartflow and EasyVet came to us with the merge of MedVet. It's my understanding that MedVet clinics all across the United States use Smartflow. When it was initially rolled out, those that were employed at that time got to attend hours of training. I believe it was 2 or 3 days of 4-hour slots, so we could all understand how to navigate it. Then there were some volunteers that attended more hours so they could become a super user. I was one of those volunteers. There are definitely some limitations we have to work within. Dr. Pell, the hospital director over at Meridian now, was at the time the ER doctor supervisor, tried to change some of the terminology so it wouldn't be as confusing, but that's not an option. However, if we use the system that's built into Smartflow, we can easily improve our communication between all of us and therefore improving our overall ER workflow. Use your boxes. If you work with me, you probably hear me say this multiple times a shift. There are so many boxes to use, but which boxes should you use and when? First, you must start with the workflow view. Knowing the differences in nursing, you guys use typically the timeline. It shows you how many tasks every patient you may have in the department, ICU or intermediate, that have tasks assigned to it in different hours. And it allows you to see what may be pending. Maybe it's ask a doctor and they're in rounds, or you were unable to complete something because you didn't have a buddy, but because it's not filled out, it leaves the task unchecked. In the treatment area, we use the workflow. This shows you the boxes from the front of the door all the way through the process of getting to go home. That is what we're discussing today. We're going to try to get to the iPad. Kat is going to help me with that. So I can show you, unfortunately, the iPad and the desktop, both, you access the way to get between the timeline and the workflow option differently. We know when it's up or if we abort.
Can y'all see that?
Looks
Can you see-
beautiful.
You guys can see the iPad
Yes.
and me signing in. Great. Okay, I'm going to move this guy out of the way. To get between, so this is currently on the timeline view. Underneath the blue plus sign, there are 3 lines that moves it over, and you can select workflow. At the top, I'm sure everyone knows, you can go to the different areas. This is the treatment. I'm just going to pick on Stella for a moment. You can also, under where it says workflow and the date, there's an arrow at the far right hand side. You click that and you can hide or show the workflow. On the desktop, which we'll get to in a little bit, everything is on the right hand side. It's a little less, the iPad is a little less intrusive in my opinion, and I prefer using the iPad, but you're more than welcome to use the desktop. Okay, I'll let you.
There we go. Looks good.
Oh. It says first steps, yes?
Yes.
Okay, good. So the DCs and doctors have always done a great job with the Smartflow workflow through the first 3 boxes of the patient's workflow. An animal walks in the front door. When it's triage, the box is checked, done. The whole clinic knows someone has looked at this animal. We may not know who, but somebody has looked at this animal and has either determined it needs to go straight to the back or it can wait in line. As the history is taken from the client and the vitals are recorded somewhere, sometimes it's on a sticky note, not in the chart, unfortunately, but check, it's done. Everyone knows we have vitals somewhere. We have a history somewhere. Then the doctor either volunteers or is voluntold that they get to have the next patient. They assign it to themselves, and then it's checked, done. Then we start to fill this communications tool. The next box is the care plan box. There is not a shift that I do not hear. Has anyone seen a DC? The doctors often hover or helicopter at the DC counter, hoping to spot a DC. Our DCs are valuable. Unfortunately, the number of them will always be limited and never enough for the busiest of shifts. When a doctor has created a care plan, to go over with a client, they need to go, let's see if, no, it doesn't show I can't show, my arrow is not showing you up there, but anyway, you click care plan created. This will make the box a 1 out of 2. If you cannot find a DC immediately, you are still communicating as a doctor that the plan is ready to be presented to a client if the DC returns prior to you finishing your next room, your conversation, checking on another patient, taking a phone call, etc. Rather than having to stand there, having a wait time, a loss of time, waiting for a DC to return to ask for the same thing to be done. If you are the DC or technician stepping in to help with care plans, if you notice a 1 and 2, it is then communicated that there's a plan to go over. You should review the plan, make sure you don't have any questions yourself. It may be an odd situation or procedure and you do need to talk to the doctor, but if you feel comfortable, you can proceed to talk with the client and get them to put down funds. Once the care plan is approved, again, check that care plan approved. This will show it 2 out of 2 and make it grayed out. This communicates to the doctor if you do not see them when you walk through and before you get pulled to your next triage or discharge, to know that the client has approved, money is down, and they can start writing their orders for technicians to proceed. This improves time management and efficiency and saves a lot of time. DCs and doctors both need to use these boxes for care plan to communicate regarding care plans, because it is an essential step later when we talk about the technicians getting ready to do sedated procedures or hospitalizations. So check your boxes. The diagnostics and procedures boxes come next. Sometimes they go hand in hand, but not always. In the workflow, diagnostics are just that, diagnostic tools to be completed. Blood, urine, fecal, radiographs, FNA, cultures, both those that are done in-house and those that are sent out. Procedures in the workflow is anything that's not a diagnostics. Could be a pain med, could be serenia, could be a steroid injection, sub-Q fluids. Anything that's not a diagnostic is a procedure in the workflow. The technician who's committing to do the procedure or diagnostics would then select progress, which comes up as the second box, and will make the yellow box read 2 out of 3. This indicates that someone is gathering supplies, finding the pet, and completing the task. Unless you are helping the person who put the animal in progress, you should move on to the next patient. So there's no chance that that patient gets poked unnecessarily or receives 2 doses of a medication. When the procedure or diagnostic is complete, you check complete and you initial the individual task box within the patient's Smartflow, which will capture the charges associated. I warn you not to initial the completed until it is completed. This communicates that it is done. A patient can be discharged before you get actually to the patient if you choose to do this. It has happened. Put it in progress, communicate with your team that it's being worked on. If you initial and say it was done, and before you get to your patient, a stat comes in and you put things down and you stop, that patient is been communicated, it's ready to go home. We will have to call the client to come back to get those procedures done. This communication does not restrict any communicating you can in person. If you see a doctor and want to share, I did those radiographs, they're ready for you to review, or a doctor walking through saying, hey, I'm to put on your radar, I'm about to add some pain meds for meso. It looks like a broken leg. If a patient is on a whiteboard without any numbers, there should be no orders under that chart if I were to open it. I question why Lucy, the second patient on here, who is going over a care plan, has no diagnostics marked, no procedures is marked. Why are we on the treatment board? Probably should still be on the triage board. My guess is it is just unfortunately not communicating what it is that needs to be done. Evie, who also has everything zeros, the diagnostics is done. So it's okay that there's nothing to do, but I shouldn't have to open up every one of these patients every 2 minutes to make sure that there wasn't any changes made to the orders. If you're a tech who may be an intermediate and have a moment, you want to help, or you're a floater and that day and you want to see what you can help with. Or for me, when I arrive later than some of the others at 7 o'clock and I'm ready to work, but I don't know where to start and no one's currently in the room for me to ask, everything is right here. For these patients here, I can tell you, looking at the chart, Duke is already done. There's nothing to be done at the moment. Doctor's probably talking to them. They're making a plan or he's getting ready to go home. Nova and Margot, well, they're both having diagnostics done. Probably where the 2 technicians that might be on shift with me might be found would be with those 2 patients. And Milo and Ebenezer both have diagnostics to be done that I can look into to see if I can manage either of them by myself or find a TA or another helper. I can do this without waiting for someone else to return to the room and give me rounds. If someone does return, please get the rounds so you know who's maybe grumpy or who might be more critical. But the fact is I don't have to waste time waiting to find somebody to tell me what to do. It's right here. This also communicates to your DCs, for your DCs, that if someone wants an update, maybe Milo's owner is asking, what's the status? They can easily look up and say, well, the doctor has ordered diagnostics. You don't have to look to see what kind. They've ordered diagnostics, but the technicians are currently working on the 2 patients prior. They'll get to them soon. Or if it's Nova's, they're currently doing the diagnostics soon. Hopefully the doctor will be reaching out to you to talk about the next steps. So what if after a procedure box is checked off, the technician puts it in progress, completes it, and marks the 3 out of 3, and we need to add another procedure. An example would be methadone given upon arrival. 1, technician puts it in progress, gets the med. 2, gives the animal to the patient, gives the medication to the patient. 3, now it's a 3 out of 3. But now we want Cerenia and subQ fluids. The doctor just has to unclick the 3 and the 2, and it will again say 1 out of 3, and there's new procedures to be done. This is also important because unfortunately there are late additions that are often missed, and then doctors get frustrated that there's a wait time because no one saw the subQ fluids and Cerenia had been added later, or another diagnostics had been added after diagnosis had been completed. So now it gets confusing because we've talked about procedures on the workflow. We're going to now introduce procedures as a whiteboard. It looks like we're in an aquarium, but we're not. But above the wet sinks in the treatment area, these 2 screens are always open. On the left is the treatment whiteboard. This is anything that does not require sedation or anesthesia to complete, and the patient is not being hospitalized. The amount these clients will be spending this day is typically a lower dollar amount. A doctor can put patients on the treatment board without a care plan signed. Not always recommended, but verbal approval is acceptable. The doctor then takes responsibility for treatments if they don't get paid because it's already completed. On the right side is the procedure whiteboard. These are sedated or anesthetic procedures or those patients being hospitalized. These end-up bills are going to have a much higher price tag. These require a signed care plan and money put down. For the sedated procedures, it also covers the risk factors sign so that we are covered. Verbal approval is frowned upon. If there's no care plan, workflow for both created and approved, the technician should hold and inquire with the DC or doctor before moving forward on that procedure or hospitalization. So a quick quiz. Maverick has a procedure. He has got a 1 out of 3 circled. On the prepare for procedure note, procedure, it tells me that I have a quick clean of a wound and bandaging a foot. Would this procedure be on the treatment board on the left or the procedure board on the right? Well, I do not have anyone in this room, so I cannot see who everyone thinks, but the answer is the treatment board. There is no sedation given. If it said methadone, you could still be on the treatment board, but if we're giving actual Alfax, propofol, or Dexmed, it would be a sedated, it would be on the right-hand side. Once upon a time, it was determined that we should not do multiple sedated procedures at a time. 1, it takes at least 1 dedicated technician to stay with that patient. And if there are 2 with sedated procedures, do we have enough hands on deck if a stat were to come in without 2 technicians able to help? Usually the answer is no. But you can do a clip and clean without a sedation at the same time as a sedated clip and clean, because that unsedated procedure could be put away in the cage under progress if a stat were to come in, and when the stat was handled, the patient could reconvene the clip and clean and then be marked completed. A therapeutic would be entered, which is a whole different training, and then it would be marked completed and the patient can go home. Probably the least used yellow box is the admit box. This is the last box on the workflow. Patient orders have been put into the patient's individual Smartflow treatment sheet. The patient is moved to the procedures whiteboard correctly. but orders complete was not marked. Maybe the doctor is checking on medications that the dog or cat may have at home from the owner to find out exactly any indications of changing their meds. Or maybe they're a new intern that has to run their plan by another doctor. If it doesn't have a 1 out of 3, it tells me to please hold. Do not hospitalize yet. In addition, there's a doctor treatment approval box within the patient's individual Smartflow that is also widely missed, that must be initialed by a doctor that the order sheet is complete and ready for hospitalization. Now, sometimes you can mark the 1 out of 3 for admit, orders complete, without doing the treatment approval box if you are still waiting as a doctor for the diagnostics to be done before you decide all the medications the animal may or may not be receiving. For me, if there are multiple patients that need to be hospitalized, and I don't know of any particular one that might be more critical than the other, the patient that has both the orders complete and the doctor's approved treatments box initialed is going to be hospitalized first. It is more efficient as a technician to get everything done at the same time rather than thinking you're done, starting writing your rounds, going to give rounds to either the ICU or intermediate nurse, and then look and see that there's 3 more medications to be given or another thing that needs to be done. And so you have to stop, go do those few things, fix your rounds, and then round again. The technicians should be checking the diagnostics when it's completed. Again, so the doctors can get to those orders and making sure that they can check that little box. And it communicates the situation. But when an animal is being hospitalized, oftentimes you're going to have multiple ones. You will have a 1 under the procedure because it's a procedure to hospitalize. The 1 for orders complete is separate. When the diagnostics are complete for fish, the diagnostics are already completed. It would be an immediate 2, right? Because but the technician can mark the diagnostics have been completed. On cash, if it's a jaw injury, if he's being admitted, then both 1 and 2, diagnostics and procedures may be marked as 1 in addition to the admit marking 1. Then when you're working on the procedure and diagnostics, the technician will make it a 2. And on here, the technician only completes the admit checklist when it's completed, or the other 2 numbers are 3s. Okay, we're going to try to go to live view. So if I go here and I go to here and I go into here, do we still, everyone see the Smartflow? No.
Can y'all see it now?
Yes.
Can you, the desktop?
Yes.
Okay, so here you would hover to get between the timeline and the workflow. You hover on the right-hand side. If we open this patient up and you want to see your workflow here, it lays it on top of the hours, which is again why I don't personally like it, but you can still manage your 1, 2, 3s. I'm not going to mess with it because it's downstairs and I don't want to mess with that right now. Let's hide the workflow. Let's go back to the work. This says, so we're on treatment. Based on this, there's no diagnostics that need to be used, no procedures that need to be used. We'll look again here and do a little scrolly. Oh, look, looks like this patient actually needs to be on procedure because it needs to be hospitalized. And it looks like maybe all of the diagnostics are done. So it should be on the procedure whiteboard, not the treatment whiteboard. There should be a 1 over the diagnostic, a 1 on the procedures, and a 1 on the admit. The care plan looks like it's being worked on, so you wouldn't actually start hospitalizing this patient until you have a 2 over 2 care plan, and that may be why Dr. Montoya has not yet moved this patient to the correct whiteboard and marked the 1 and the 1 and the 1. See if there's anyone on procedures. Maybe. Easier said than done. I don't know how to get to the bottom of it on your, how do I get to further down?
At the,
Oh, it's still not. I apologize.
no, you're okay.
Okay, so there's two, oh, there's in timelines. We're gonna change it to my workflow. Okay, so we're in procedures. We have a diagnostics, a procedure. Probably gonna be sedated, probably, maybe. Why are we over here? Actually, it looks like a hospitalization. So this is an example where she did the 1-in-1 but didn't do the orders complete. And down here is the doctor treatment approval, which is missing the doctor's initials. So, and there is some pending diagnostics, so they may not be ready to initial that, but that's where that box is. I don't know why it's trying to show me that. Penny, bless you, has a procedure. Oh, it's going to have a scope. So it's a sedated procedure. Let's see our workflow. We do not have a procedure here. And we do not have a care plan. So it could be very much that they're still looking at doing a care plan and the procedures will then be marked to get started. So it's just over there holding, right? But the whiteboard is telling me there's nothing to do. And neither of these patients are, Penny is not ready to do. Marshall has something to do. There's the diagnostics and procedures. The doctor just happened to miss the admit box right here. Okay, I'd like to go back to the other screen. I'm sorry. So just to clarify, using the boxes does not replace respectful verbal communication. It's a tool that extends and improves communication beyond verbal communication when not all parties are present to be part of the communication.